Another question. I'm gonna go to a live question. I know Ebenezer Okra, you raise your hand. If you can take yourself off mute and present your question, and I'll help delineate who it needs to go to. So please, Ebenezer, what's your question, please?
All right, thank you very much. My question, first question is, with the new variant going on around, what's the best way to protect ourselves? Is double masking the right way to go? Two, with the governor's lifting of masking across the state of Texas, what's the best way to protect? If you're working in a retail environment or you're in an environment where somebody is not wearing a mask and the person is supposed to serve you as a retailer, what is the best way to go around it from the medical perspective? And when you do grocery, I mean, I've heard so many things, and I want the professionals to confirm. Is it when you get grocery from the store, if you bring it home and you don't wash it, are you susceptible to what do you call it? Catch the virus? And then that has to do with your clothes too. If you step out and you come back, is it necessary to go straight and put the clothes in the washer, or there's no risk that it poses? Thank you.
Okay, thank you for that. I know that was a multiple part question. Dr. Hazel or Dr. Boachi, if you want to take any part of that and elaborate on it, that would be really great.
All right, I can start. I can start by addressing the masking and how to protect yourself. So to protect yourself from the virus, the good thing is we know exactly how to do it. Social distancing, wearing a mask, and washing your hands. Those are the best ways we have to protect ourselves. Outdoor environments are better than indoor environments. Any environment that includes recycled air, especially without a HEPA filter, it's not a very good environment. And any environment that has a lot of people in close contact with each other is also not the ideal environment. So those are the things that have been preached since the beginning of the pandemic, and those are still effective at not just protecting you from the original coronavirus, but also the variants. If you work in a grocery store, one of the ways to, especially in a state like Texas where the masking mandate has been lifted, if you want to protect yourself, especially before we reach herd immunity, which we haven't reached yet in the country, is to continue wearing masks and following these protocols. Lastly, I think with regards to washing your clothes and washing your groceries. Initially, when the pandemic started, I think there was we didn't understand a lot, and we thought the majority of the main way that the coronavirus was being spread was through contact. And so that's why there was a lot of emphasis on that. But as time has gone on, we found out that the main way that the virus is being spread is through aerosols or particles in the air from people's breathing or talking and stuff like that. So right now, there's not a huge recommendation to be washing your groceries or washing your clothes, because we don't think the coronavirus is really spread much through those means. So I'd focus more on the social distancing, the masking, and then trying to be outdoors when congregating with people. Dr. Bachi, I don't know whether you have anything to add to that.
Yeah, not a whole lot. I agree with everything you said. Basically, things we've been doing since last year: social distancing, washing your hands. What you need to remember that the mandate being lifted in Texas doesn't mean that you shouldn't do it. It just means you're not being forced to do it anymore. Okay, so you should still protect yourself even after you get the vaccine. You should still, wear your mask and do social distancing and wash your hands and all the stuff that we've been doing since last year. So, not a whole lot has to change until we achieve herd immunity, which is the ultimate goal. So just keep that in mind.
One question that came up in the that has been presented on the board is, what are the long-term concerns 30 years from now? Will the concerns come up from this vaccine? So does anybody, I think I can go to Cynthia for this. Do you have any concerns about the long-term effect of this vaccine? And then after that, I'm going to come to you, Mr. Mam Jonas, for your question. So Cynthia, 30 years from now, do I have to call a lawyer or something for taking this vaccine? Please help me.
Thanks for the question. So yeah, we've heard so many questions about, what happens 20 years from now, 10 years, will I grow like a third eye or something like that? And that's a legitimate question, because we have a pandemic that, is ravaging lots of communities and something needs to be done now. It's part of the reason why a lot of, red tape has been eliminated and we've had to move at a very fast speed. And so the simple answer to the question is that we don't know. We don't have all the information we need to be able to, make that assertion that this is what is going to happen 20 years from now, 30 years from now, or even 5 years from now. What we do know, though, is that the COVID-19 vaccine is not the first ever vaccine that's being developed in the world. We have so much information from different vaccines that have been developed for different types of diseases. And so vaccines just have an underlying baseline metrics that we apply. And so even though the COVID-19 vaccine has different information, because it's a new virus, a new type of technology, at baseline, all vaccines go through the same processes, work the same type of way, and our bodies react generally in the same way. And so there's no reason for us to suspect that this COVID-19 vaccine is exceptional in the sense of it's going to, long term, is going to develop some type of wild symptoms, or is going to cause some issue that we haven't seen before. Again, the way this vaccine has also been developed, even though it's a new technology, the mRNA technology is really not that new, especially for the Pfizer and the Moderna. It's been understudied for some time now, and so it's not also a new technology that was just discovered when COVID happened. And so they have a lot of scientists who are studying these vaccines, how they work. And so at this point, even though we don't have all the information we need to be able to answer that question, there's no reason to suspect that we have to fear anything 5 years from now, 15 years from now, or even 30 years from now.
Awesome. Thank you. Thank you for that response, Dr. Cynthia. Dr. Hazel. Cynthia Hazel, sorry. One other question. I think I'm gonna go this to the physicians on this. Dr. Quick and Dr. Wachi. I know there's discretion on this to probably talk to your primary care provider, but I wanted you to share your perspectives on what the safety around and concerns around pregnant women taking the vaccine. Can you guys shed any light or provide any input on information on that as to if a pregnant woman should take the vaccine or not? Dr. Wachi, can you take this?
I think the data on that is still coming out. I do know that the AstraZeneca one right now, or the adenovirus ones, are not being recommended. I think, and I have to double check on this, but I think we're getting more information on the Pfizer and the Moderna one that they may be okay in pregnant women, but I don't have the numbers off the top of my head for those questions. Sorry.
Okay. Dr. Hazel, any input, please?
Yeah, I agree with what Dr. Barcher said. And to add to that, I think I've also seen a little bit of the preliminary reports on the study on pregnant women, and they look good. It looks like we are headed to being able to give the vaccine or recommending it for pregnant women too, but we'll wait for the final result. At this time, though, there's no contraindication, or what I mean by that is we are not stopping pregnant women from getting the Pfizer and Moderna vaccines. Pregnant women are getting it right now. I suspect thousands of pregnant women have already been vaccinated with the vaccine, with the Pfizer and Moderna vaccine. So it is happening, and right now you do this on an individual basis. You talk to your OBGYN or your primary care physician and decide based on your individual case whether it's a good idea to get the vaccine or not.
Thank you very much, both of you, for providing some input on that. I know I said I was going to go to Mr. Jonas. If you can unmute yourself and present your question, please.
Okay, thank you. My question is more elaborative. I want to really understand, because I feel like the vaccine is being, pushed down the throats of us. Because here in Ghana, there's something coming out now. It's a vaccine certificate. The same way in the US, we have the vaccine. We are trying to see if you are traveling, then the vaccine passport. I'm a young man. I have no child. Okay, I'm yet to get married, yet to have kids. There's no data to even show me that, okay, it's not going to affect me to have children tomorrow. And our governments are in a hurry to take this COVAX here and elsewhere as well. I have no issue with that. If the world is going down and there has to be something done, I have no issue with that. But the problem is we have to be careful here, because we are dealing with the human body. You can't take from it, you can't subtract, you can't add. And when you want to add, you have to be very careful in adding to the human body. Just like when someone wants to smoke for the very first time, the person reacts, like coughs out the smoke, because the body is not used to it. We have to be very, very careful here. That's my first point, because I'm afraid to take the vaccine. I have not shown any symptoms of coronavirus or anything. And I'm told that if I want to travel out of the country, I have to take the vaccine. That's my first issue. Number two, there's a breakthrough. Scientists have done very well. Doctors have done very well. I understand, in terms of polio. Those days, polio, when I was growing up, malaria, tuberculosis, and guinea worm, and all those things. There was an elaborative time for them to sit down and think about developing something that could take out these, even malaria, to take out these diseases here and there. But if you look at this COVAX, you look at Moderna, you look at Operation Warp Speed and all these things, it looks to me like the vaccines were accelerated and it was in a hurry, So how safe is that for me? Something that has been accelerated in just under 9 months or 8 months. Well, as polio and all those ones took like 5-6 years. That's my second concern. And then my last issue is let's try not to make this the whole vaccine thing something that will make us terrified. Because for me, my colleague came to work and he told me the mom took it, the COVAX, and the mom has serious headaches. Up until now, the mom is not able to move the left leg. It's very serious. That was the Friday at work, just yesterday. My colleague told me that the mom is in critical condition now just because she took the vaccine. And I'm very, very disturbed about this. So these are the issues, and that's how I'm looking at things.
That's good enough. Yeah.
All right, Dr. Hazel, can you please, Dr. Kwaku Hazel, can you please help address some of the concerns that Mr. Jonas has shared with us?
Yeah, Eugene, I would start and maybe I'll have Kwaku touch on some of the points. Yeah, so thanks, Mom Jonas, for the questions. And I think these are legitimate concerns, to be afraid and to get worried about, your own family members, your community, and what is going to happen. Why are we being forced? And so I'll just address some of the few concerns here. So first and foremost, I think it's important for everyone to know that the coronavirus affects all human beings the same. Through this clinical trial, we haven't figured out that it affects Africans differently or affects Asians differently or white people differently. We all have the same internal body systems. And so what the research has shown is that how it affects people in Ghana is the same way it can affect people here in the United States. And so that's a baseline. We all need to understand that. What that means is that everybody is at equal risk of the outcome of coronavirus if you do get it. If there's some people in the United States who can easily recover from the coronavirus and other people go on to die. In Ghana, we've also seen examples of that. Some people get little sniffles, cold here and there, others to get it, they're on a ventilator. The next thing you know, they've died. And so at baseline, we all need to understand that we are at equal risk regardless of the geographic location. Now, secondly, as far as mitigating that risk is concerned, there are over 30 million people in the United States who have already been vaccinated, and there hasn't been one example of death that has any causality link. There's absolutely nowhere in the world right now where a causal link has been established. And when I say causal link, we have been able to hold everything constant and ascertain or confirm that it was the vaccine that caused this problem or the vaccine that caused this death. Nowhere. Papers that have even come out to suggest have been debunked now by other scientists through peer review, that there is absolutely no causal link between taking the vaccine and having death as an outcome. So that's another fact that we should all know. Now, thirdly, Ma'am Jonas, you mentioned, COVID certificate and all that. So that is not, from a public health standpoint, that is not new. Most of us who have traveled in Africa or even outside Africa have been asked about our yellow fever certificate. Now, in many countries, that is the strategy they use to mitigate new diseases from being introduced into their countries. And so in Africa, in many countries in Africa, since yellow fever is still a problem, there are specific countries that when you're traveling to, they ask you for a yellow fever certificate. And if you don't have one, you have to get a shot at the airport before you are allowed to board. Now, this process is not going to be any different from the coronavirus vaccine. If a country decides that coronavirus took so much of our resources, and so we don't want it introduced again in the future. And so for anybody coming into our country, they need to have been vaccinated to be allowed into the country. At that point, how else would you be able to show that you've been vaccinated if you don't have a certificate? So most people here in the United States who have been vaccinated have a little card to show that they've been vaccinated. And what that card does is that it actually puts down the specific vaccine that you received. Every vaccine has a specific ID that comes with the vaccine. And so having that ID listed on that certificate is it's your evidence to show that indeed you have been vaccinated. And so the concept of having a COVID-19 vaccination certificate is not new at all. I don't want us to separate that as something new or something scary. It's just the same way as the yellow fever certificate works when you're traveling. That's just how that process goes, and it's just for population protection. And then as far as also like how fast this vaccine was developed and all that, we all remember the Ebola scenario not too long ago. Ebola was not too long ago. Ebola wasn't new, but the method, how it was being transmitted and how fast it was affecting people, became concerning, and it became an emergency. And at that point, we didn't have all the research needed to be able to either wait and develop a vaccine, and we didn't have any of that information. And so in the same way as we are treating COVID-19 because of the urgency, it's the same strategy we used for Ebola. How we are treating the situation right now is not new in public health. This strategy is not new. The same way we had to come all hands on deck, try testing strategies to prevent Ebola from getting worse is the same way we are doing right now. And then finally, Jonas, I don't think that there's any public health professional or physician or healthcare professional out there who is forcing anybody to take the vaccine. If anybody tells you that by all means you should take the vaccine, then you should reject them. Our goal here as professionals is to make sure that whatever decision you come to is based on accurate information. Whether you decide to take it or not, it's a personal risk. It is a personal prophylactic and also for community protection. You are protecting yourself and also your family and your community. And that is the whole goal. If we are going to get protected, we have to reach what is called a herd immunity. One person getting vaccinated in a population of 100,000 people who are not vaccinated is no use, it's no good. So part of that education is to help provide you with that information so that you can make that decision for yourself. Now, at the end of the decision, at the end of the day, if you come to the decision that you do not want to take the vaccine, that is okay. What will not be good is that that decision is based on false information, myths, and rumors that have no basis in facts. And so that's our goal here this morning or this afternoon here in Dallas.
Yes. Thank you so much, Cynthia, for that input. And Jonas, I hope that helps clarify a few things or your worries on your list, and you're able to take this and help make it an educated decision for yourself. I want to move on to the next question, which it's from Kwabna, and he's asking specifically that his question basically says, are masks being worn to help not spread the virus or to help not contract it? He wants the delineation between those two. And after that, I'm going to come to you, Mr. Martin Osai, to help clarify. So I'll go to Renee with this question. Is the mask being worn to protect ourselves or to prevent the spread of the virus?
I would say a little bit of both, honestly. I mean, you want to make sure that if you, we could be asymptomatic, first of all. So everybody wearing a mask could help protect the next person. So what I tell a lot of people, even with getting vaccine, you're getting the vaccine to make sure that you're protecting yourself and helping your family members. So you want to make sure that, wearing your mask can, this is a disease that's spread through droplets. So if you don't wear a mask and you do carry the virus and let's say you cough or you sneeze, you could actually spread it to somebody else.
Piggyback on this and also add this to your answer, why you should still wear a mask while after you've been vaccinated. Can you please elaborate on that?
All right, so I just want us all to just think about how this virus is spread. So in my clinic, I'll say 99% of the people that I see who test positive, they got it through this way. They were within 6 feet without mask for more than 15 minutes in contact with someone who had the COVID. So let's always have that in the back of our minds. Anytime we are within 6 feet with someone without a mask, and we talk to them for more than 15 minutes, whatever we have, we're giving to them. Whatever they have, they're given to us. And so let's just keep that in mind. So that kind of adds to Renee's answer. So it's a two-way street. It keeps you, if you have it, the mask keeps you from passing it on to someone else. And if you don't have it and someone else has it, you put your mask on and it keeps you from getting it. And I think what the doctor said already, we know this virus enough now to know that really a lot of people don't get it from surfaces. Majority of people are getting it from social interactions. And so that's why the mask is important. And even after you've been vaccinated. And so the vaccine kind of helps to prevent you from having the COVID disease and prevents you from dying from COVID. But there's still a small percentage that you can still catch it, and you are not going to die of it. But if you can catch it and you're carrying it, then you can pass it on to others. And so we just encourage you, especially if you're out and about, to continue to keep your mask on, just so that you are, protecting the people around you who have not had the chance to be vaccinated. Now, if your entire family is, your entire, extended family is vaccinated, then, we have a little more wiggle room. But if you're in a mixed, close contact with people who have not been vaccinated and you have been vaccinated, just give them the courtesy of keeping the mask on to protect them as well.
Mr. Martin Osai, I know you had a question. I was going to come to you. So can you please present the question for all of us to hear?
Yes, mine was just a comment that our church houses are critical in our communities, and some churches are in person now. Make sure you are going to a place that these protocols are completely being observed. Hand sanitizers are available, social distancing, and wearing the mask. Even though the governor have made a mandate, unmandated, that doesn't mean, become foolish and not wear a mask. So we want to be careful that as we go to our church houses, and I'm speaking from the clergy perspective, that we are observing this protocol strictly. This is all about protecting all of us and our community. So I just want to say thank you to Ghana Professional Network for organizing this and all the experts and the physicians who are here to educate the community. Better day to do this than on our Independence Day, protecting ourselves. Thank you.
Thank you, Pastor Martin. I'm going to go to Mr. Lawrence Dagadu. I know you have your hand raised. Do you have a question or comment you want to contribute?
I have a question. Okay, my question is in two parts. If you're asymptomatic or pre-symptomatic, then that is you got the virus, but you don't know anything about it. When you take the vaccine, what kind of reaction or effect are you going to feel? And the other question is it better for everybody to get tested first to make sure they are negative before they take the vaccine? So the doctors can address that for us, Yeah.
Thank you, Mr. Lawrence.
So I'll start. Very good question, Mr. Dagadu. So I don't think I've seen any study that has shown the answer to your first question in terms of if you have any symptoms or you have it but you don't have it, you shouldn't take the vaccine or not. I don't think I've seen any study with that. There's also no recommendation that says that we all need to get tested. If you don't have any symptoms, just go take the vaccine when you have the opportunity to do that. Whether it's everything about COVID is so new, it's hard to tell what's going to happen if you actually have a COVID. You have the COVID virus, but you didn't know about it and got the vaccine. I don't think we have any data to tell us exactly what's going to happen with that.
Thank you.
Okay.
Were you going to add something, Dr. Quick-Hazel?
Yeah, I can add to that a little bit.
Okay.
So I agree with Dr. Boachi. This hasn't been extensively studied, but we do know that it's been happening. People who have the active infection or are asymptomatic and just are colonized by the coronavirus have been able to get the vaccine. And from what we've seen so far, it is not a contraindication, or it does not stop you from being able to get the vaccine. Currently, I think we are recommended that people who've had the infection wait a little bit. Sometimes people say 2 weeks, some people say a month, some people say 3 months before you get the vaccine. A lot of it is based on supply and demand, because we don't have enough vaccines, and people who get the coronavirus infection do have a few months of protection. We want to prioritize those who don't have that protection in terms of vaccinating them. So that's why you see some of those recommendations with people who've had the virus or the infection to wait a little longer to give other people a chance to get the vaccine that is in short supply. Obviously, if you have an active infection and you have active symptoms, we definitely recommend you don't take the vaccine, because it can mask some of the effects the vaccine can have. So we definitely want you to be over your coronavirus symptoms and infection before you take the vaccine, especially if you're symptomatic.
Thank you very much, Dr. Hazel. I know, Angela, Mom, I know you had your hand raised for a while, and I know you typed a question, so I can read the question, or I can give you an opportunity to ask it directly.
And that's fine. Part of my question got answered on just now when he was talking about those who've had the virus, because I actually had the COVID virus. I'm almost 3 months out, and I don't want to take the vaccine because I have very bad reactions to flu vaccines, any kind of flu vaccines. I actually get sicker and sicker anytime I take a flu vaccine. So since it's a type of flu vaccine, I am avoiding it. I spoke to my GP and I explained to her that this is the reason why I'm trying to avoid it. So if I don't necessarily need it, then I'm not going to do it unless I'm mandated to do it. With something like I still wear my face mask when I go out. I still use a face shield when I don't feel like, wearing a face mask or whatnot, but I usually don't go out. And if I do, I make sure I protect myself and I protect those around me. But the question I wanted to ask is that, do I really need the vaccine? If I've had the virus and I've had some antibodies, at least my body kind of knows it kind of registers that, hey, you've got this before, this is how I defend myself when it happens again. Do I have to take the vaccine?
Thank you for that. I'm gonna give it to the providers, the doctors, Aaron, whoever wants to pick this up and elaborate on it.
I can start on this one,
Okay.
and anybody else can chime in. So the short on the answer is nobody really needs the vaccine. That's the truth. Nobody really needs the vaccine. It's important for majority of us to try and get it so that we can get the disease out, but nobody actually really needs the vaccine. So right now, with your question, if you've had coronavirus, what we know is that you have some level of antibody protection in your body. The vaccine, when you get the vaccine, that protection is about 10 times what you get from the natural infection. So the vaccine does provide you with more specific and a stronger level of protection from what we are seeing now. We are also finding out with new studies that those people who have had the infection and get get the vaccination after have an even higher level of protection from the coronavirus. And there's some new studies that are indicating that the protection you get from the vaccines may last longer than what you get through natural infection, because we've seen cases where people get reinfected with the coronavirus after they've had the natural infection. And sometimes those reinfections are more severe. At first, they had a mild infection. The second time, they are intubated and in the hospital. So that is possible. And so as long as you know that, you can make the decision for yourself on whether to take the vaccine or not. But that is the information that is out there right now with regards to people who've had the infection and whether or not to take the vaccine.
Thank you very much. Anybody else want to elaborate on that or have anything else to contribute? We can move on to the next question. So I know, thank you very much, Dr. Cynthia Hazel. She's answered some of the questions in the chat group. And I also want to make sure that be respectful of everybody's time. At this point in time, we're 26 minutes over. There's a lot of time. So I think we're going to take 2 more additional questions. And I'm going to give you some contact information, or you can email us through GHPN email address if you have any additional questions, and we'll reach out to any of these professionals and physicians to help address them. The one question I had here is from Angela Ozu, which is my mom. And she said, I read in Ghana chat group that you should not have alcohol up to 72 hours after the vaccine. I get it, but could this be true? So should you go get drunk the minute after you go see you go see Renee and collect your vaccine? Should you go straight to the bar?
The break.
So on the 50, while you're sitting in your car for the 15-minute period, what do you guys have? What kind of advice would you like to give us on that?
The answer is I do not know. Again, in science, we use evidence-based medicine, right? So I've not seen anything published in any medical journal that you shouldn't drink or you should go drink. So I've seen that quote in Ghanaian chat groups. So I think it's all over. Whether you should actually drink or not, I don't know.
Okay, thank you. Anybody have
I think some of those people are spiking their sobolo with some alcohol.
It's all to help the virus react faster.
Question is, wait 72 hours. Is that, should we wait?
Yeah, within 72 hours. Within 72 hours, she says. Dr. Hazel?
I can add a little bit to that. So in general, when you have any significant medical procedures, for example, if you have a surgery or something like that, we don't recommend you take alcohol or a significant amount of articles in the immediate post-operative period. And I'm sure Dr. Brache and Aaronet can also attest to that with medical treatments. And so that's a general principle in a lot of medical, especially significant medical procedures or treatments, because what the alcohol sometimes can do, especially significant one, they can mask the effects of the treatment. So for example, if you get drunk, it can be hard for me to tell whether the symptoms you're having is due to you being drunk or due to a reaction from your surgery or a reaction from your medication. So if you're looking at monitoring the post-vaccine reactions, being drunk immediately or shortly after you get the vaccine is going to hide that, and that could be actually deadly. So I think there's some sense in telling people, hey, wait a little bit before you go back to your drinking or whatever you do. That could mask or confuse the symptoms of maybe even a vaccine reaction after you get the vaccine. So I think it makes sense to wait after you've gotten the vaccine.
Thank you for that. So I'm going to take 2 additional questions, and then we're going to wrap this up. I'll come to you, Julius. If you could unmute yourself and ask your question, please.
Oh, Julius?
Yes.
Oh, yeah. Thank you for organizing this. I think it's a wonderful forum for us to be educated. I have a question and an observation.
Okay.
I know most of our people believe in church and pastors.
Yes.
I can see the turnout here was around 58, somewhere along the line. It's now 47. So what are you guys doing in bringing our churches involved so that they will hear this message? Our pastors are the people who are the forefront of the disinformation. Yes. So if you can target that source, that will do us a lot more good. Okay. That's my suggestion. And my question is, what percentage of the population ought to be vaccinated for us to attain herd immunity for the COVID-19? And at what point after having herd immunity can we start having our free life, public gatherings, and all other things? All right.
Thank you. I'm gonna thank you very much. I'm gonna point this question to Dr. Hazel, because I know you guys are doing some great work out there in Colorado exactly to this. So please help answer and address Julius's question.
Okay, thank you very much, Julius, for that question. And I'm glad it came up before we wrap this up, because the intersection between religion and COVID-19 has been a huge source of debate in a lot of African countries, because we've done this in Nigeria, in Ghana, and in other countries where we are heavily religious. And so that intersection between the science of the virus and also the religious aspects of faith and how do we combat this and the role of our religious leaders has been one that we've been tackling as part of our education campaign. So thanks for asking that question. What we would say to that, the short answer is that religion doesn't, having a religious background or being religious does not necessarily preclude you from believing in the science of, the virus or the vaccine that has been developed to fight the virus. And also believing in the science is not mutually exclusive. It does not preclude you from having faith that you won't get the virus or you won't get healed if you get the virus, So most of the time, the message that has come from our religious leaders from the pulpits has not been consistent. It depends on which church you go to and which religious leader you follow and believe. But the message has been very conflicting. While some religious leaders are saying, have faith and pray that you don't get the virus, others have also said, get vaccinated when it's your turn, because that is the way we can protect ourselves. Those people, the religious leaders who are saying get vaccinated are not saying that means you don't have faith or that means you don't pray hard enough. What we all need to understand as religious people is that, my husband is a preacher's kid. He's grown up. His dad is a reverend minister, and his mom was a clinical pharmacist. So growing up, he in his household has had that conversation between science and religion his whole life. And so at this point, we have been vaccinated, even though we are very spiritual people. We have also been vaccinated, and we didn't think that we weren't afraid, or we didn't think that meant we didn't have faith. So the way we can include our religious leaders is also to educate them that they need to be able to understand the facts for themselves. And being a religious leader or being a religious person or having direct communication lines with God does not necessarily mean that you shouldn't know the facts about the science, or you shouldn't believe the facts about the science. Scientists have been working very hard in producing the data that is guiding how to control and manage this pandemic. And I think that every religious leader has to take it upon themselves to also educate themselves and their congregation members, so that that influence that they have can be leveraged appropriately, because if not leveraged appropriately, it does more harm than good. So that's what I'll say to that. Then the second part about the herd immunity. And so there's a difference between natural immunity and vaccine immunity that you get through vaccination. If you do get coronavirus and you recover, you develop a natural immunity, you develop antibodies in your body that protects you, makes you immune from getting the disease almost immediately after. And this can go on and on. For now, we don't have enough information from the clinical trials to ascertain exactly how much or how long this immunity is going to last, because we are still like in the 9th or the 10th month from when the first people who were involved in the clinical trials were injected with the virus. We are confident that 9 months out, when you have been vaccinated, that you are immune. And so to reach herd immunity, it's not only the vaccination that we are counting on. There are some people who got coronavirus who have recovered and have natural antibodies who may not necessarily go on to take the vaccine, and that is okay. We still count those people as part of the herd immunity. And so overall, we need to get between 70 to 80% of the population vaccinated for us to feel confident that now we have the community protection that we need for moving forward.
Thank you very much, Dr. Cynthia Hazel. And I know Pastor Martin, who's on the call with us, has been doing some great work in his church and trying to educate our community on this. So he deserves a credit as well. I'm going to take the last question from, I know you had your hand raised, Audrey Arthur, asked what your question was. So if you can present your question, and then after this, I'll do a summary, and then we can give everybody back their time, because I know we're over our time a little bit. So Audrey Arthur, what's your question, please?
My question was within the last question I was asked about herd immunity, who pulls the trigger and when we would face life normal again. So I think that addresses my question. My only other follow-up question to that is, for the vaccine rollouts and the individuals that are waiting in line, not deemed as whatever group we're in, myself being, I work at home, my children go to daycare, right? But I'm working at home, and I'm probably on the last list of individuals that will get the vaccine. Will we reach herd immunity prior to that? And once we do, is it recommended that the last list of people, no underlying conditions, working from home, minimal contact, whatever the list is in the last group, how would you address those individuals while we wait to get to that point?
I can take a stab at this.
Okay.
Audrey, that's a great question, by the way. So with regards to herd immunity, it's a dynamic thing. It's an ongoing thing. It's not a static thing. You don't just get to the number and then stop. You know, it's almost like childhood vaccinations. You know, the fact that you have a first child and they get vaccinated doesn't mean that your subsequent children don't, because it has to keep going to protect the school district, all the children. When we do, it is possible by the time we get to your priority group that it would have reached 70% vaccination rates. It's possible, but that doesn't mean we're going to stop. We have to continue, because more people come into this world, more people leave the world, and so we have to just keep going to keep that rate of about 80% going to be able to protect ourselves. I think we start to relax on that when the virus completely disappears from our system. When that happens, I think that's when we are going to stop trying to keep our herd immunity rates at 80% or whatever. So that I hope that answers your questions with regards to that.
All right, thank you. The Aronette, did you want to add something to that?
Yes, just to add to answer Julius's question, as part of our contribution to our community, that's why we're doing this. And I just want you to know that, you know, the Ghana Nurses Association is available. GHPN is always available to be the point of contact. We will always come and do these education sessions at our churches. And so personally at my church, I'm volunteering to do that. And so I just want everybody to know that, we all part of this community, this DFW community. And so if you feel like, something is not going on, there's some false information in your church community and you want us to come in and do an education session, we will happily come and provide that information, because knowledge is power. And I want you guys, I'm so sorry about the noise in my background. I don't know if you can hear it, but I want you guys to know the purpose that we're doing this is for you to see us, see our faces, see what we do, and know that if you have any questions, you have any concerns, if you see any videos on WhatsApp that you're not sure about if it's true or not, please come to the experts that deal with it so that you do not, make decisions based on false data. That is really, really crucial. And we just want to emphasize that and also add that, we're not convincing anybody to take the vaccine today. We only want you to have facts to help you make decisions. So I hope that, we got something good out of this today.
Thank you. Can I ask you a question that came up? If you have, it's a simple yes or no question. If you have asthma, is it okay for you to take the vaccine? Yes or no?
Yes.
Yes. Thank you.
Yes.
Okay. Thank
Yes.
you. Thank you. So I'm going to read a statement that Elizabeth Mom, she's a doctor actually, also out in Missouri. She stated, and I think it helps us tie up this whole conversation very well, and says there are legitimate concerns with most of the vaccines stemming from the past and unethical research experience on African Americans. The mistrust with the healthcare system is real. So hopefully what we're doing in this panel is helping us get past that, and at least at a starting point to help get past that. The transparency and education will help bring adequate informed decision to our communities. And I think that statement that she put helps drive what we're trying to do here. And I do want to thank Dr. Boachi taking time out of his day out in Missouri to help us with this conversation. Dr. Hazel out in Colorado taking out their time to help educate us, and all the participants that joined us here, and everybody. And Renee, I know she's at work. She had to step away for a little bit. Thank you. And thank you, Arinette, for taking the time to help facilitate this. The groups that help put this together, Glenn, myself, and the Ghanaian Professional Network, and the other members on this phone call, the Ghana Nurses Association represented, and Joan with the Council of Ghanaian Associations down here in DFW. Thank you for sending this word out for all the individuals to participate in this. And Our Village, Our Voice, Our Journey is something, a program I'm trying to start to help bring different voices from our village out there, so we have opportunities to talk to people that will be expertise in areas that we might not have. So I do want to say a very, very thank you, very, very big thank you to everybody that joined. I want to give back the gift of time, even though I stole 43 extra minutes. I know that in the celebration of Independence Day, I know Pastor Martin has a program coming up next, so please join that. And if you do have any additional questions after this, most of you we have a network that might know me or know one of the people in this conversation, so please feel free to reach out. But on that note, thank you again. Happy Ghana Independence Day to everybody on here, and from all the people that called from international places, thank you. I hope you all have a great rest of your day.